Hello everyone, I'm Dr. Chirag Bansal. Currently I'm doing MCH Neurosurgery residency at Aiims New Delhi 6-year program. Today I want to talk about a very important medical condition called as stroke. So what is stroke? Stroke is resulting from ischemia to brain, that is neurons, and it takes hardly 2 to 3 minutes for neurons to die if there is complete shut off of the energy to neurons. And how it can happen? It can result from any of the cause which can impair blood supply to the brain, whether it is any clot or hypertension causing decreased blood flow from internal carotid artery and middle cerebral artery. Usually there is an area which is called penumbra that can be salvageable if early intervention is done. So if there is any case of stroke, that should report to the health care center within a window period which is usually 4.5 hours, so that we can either perform thrombectomy or thrombolysis, and we can reperfuse the penumbra area and the patient can be saved. So if that period is lost, then the things may become irreversible, because the salvageable area called as penumbra, which was maintained by the collateral blood flow, can also be becoming infarct due to decreased blood flow from collaterals, also because of the increasing surrounding edema. So what are the preventive factors for stroke? So the most important preventive factor is that the patient should be taking care of his comorbidities. If the patient is hypertensive, he should be taking care of his hypertension, and the proper treatment should be taken so that the hypertension should be controlled. Any uncontrolled hypertension can cause endovascular injury, and this can cause a virtuous triad which can lead to clot formation because of stasis, and this clot formation in the great vessel like internal carotid artery can ultimately lead to stroke. Also, there should be the patient should be taking care of his hypercholesterolemia. So for that, the patient should be following a healthy lifestyle, regular walk or exercise per like 30 minutes per day, and also the patient should be taking healthy food, not oily food, or the patient should be taking green leafy vegetables, no smoking, no alcohol consumption. If the patient is diabetic, then the patient should be taking care of his blood glucose levels. They should not be very much deranged, because excess of glucose can also be a risk factor for infection and clot formation. So all these factors, if taken care of, the patient can be saved from deadly complication known as stroke. Anyways, if the stroke happens, care should be taken immediately, and the patient should be taken to the healthcare center where the emergency window is there, and the patient can be saved by the life-saving measures like thrombectomy or thrombolysis. If that window period of 4.5 hours is lost, then we are not left with much options, and only option can be a decompressive craniectomy, after which the patient may not be reversed back completely and may live lifelong with hemiparesis. So stroke is a very important medical emergency which is preventable and also curable if reported to the healthcare emergency within the window period. This knowledge should be spread to everyone so that we can save as many people from this deadly complication as we can. Thank you.